Good morning and welcome to this 60-minute presentation on the usage of aromatherapy in the naturopathic practice. This is a presentation for the Alternative Medicine College of Canada, and here is what we'll be talking about today. This presentation is to complement the information in your class module F358 on aromatherapy. And the purpose of the presentation is to provide you with some more practical knowledge to complement the theoretical knowledge in your module course information. Our agenda for the next hour will be, first, we'll talk a little bit about definitions and the terminology to understand the world of aromatherapy, and we'll briefly touch on the chemistry of essential oils and how their chemistry and molecular makeup ties into with the precautions of use and contraindications of the usage of aromatherapy in the naturopathic practice. The second half of this presentation will be dedicated to discussing the common use of essential oils in the naturopathic medical practice. So we'll get started with a few definitions. When we speak of aromatherapy, we must of course speak of aromatic plants. Basically, an aromatic plant contains many secretory glands in different parts of the plant, which will produce odorous molecules. These odorous molecules, there's a great deal of them, hundreds, are collectively called the plant's essence. And the essence will differ from one part of the plant to another. In other words, the secretory glands on the roots of the plant, on the leaves, or on the flowers may produce a different type of essence. And when all of those are mixed, we call that the aromatic plant's overall essence. How do we extract the essence of a plant? We basically make an essential oil from the plant. An essential oil is an attempt at extracting the essence from the aromatic plant. And we do this through steam distillation. This is the apparatus that is used in order to do steam distillation on aromatic plants. So basically on the left here, we see that we have a source of heat, like a hot plate, and on top of it is our steam boiler. We then have a pipe that connects it to a larger container, and the pipe will send steam upwards through a sieve. On the sieve is where we will have placed our plant material, so this can be the leaves or the flowers or really any part of your aromatic plant. To give you an idea, it takes about 150 kilos of real lavender to produce a kilo of lavender essential oil, and it takes 4,000 kilos of rose petals to make 1 kilo of rose petal essential oil. So it requires quite a lot of the plant. We really are trying to concentrate all of these aromatic molecules. So the steam will travel up through the plant material, and you can see it travels then, so as it travels through the plant material, the steam will pick up some of these aromatic molecules, and it will travel upwards through the pipe that you can see there at the top. We then make it travel through a condenser, which is basically a coiled tube that is bathing in cold water. Because the coiled tube is bathing in cold water, the walls of the tube are cold. So the steam, as it hits the tube, will condense alongside the walls of the tube. This condensation product then gradually streams down the coiled tube, and drop by drop, it will fall into that little collecting bottle. There are two different things that will come in that collecting bottle. At the bottom, we will have water that is charged with some essence, and at the top of it, we will have most of the essence that will separate from the water in an oil layer. Because they separate so nicely, we are able to then put them in two different bottles. So the steam distillation process can last from a few hours to 24 hours. And the benefit of that is that we are then able to not heat up the plant material too much, since water boils at around 100 degrees. the plant material is not subjected to higher temperatures than 100 degrees, and so the odorous molecules are not denatured by too much heat. And also, we then do not need to use any harsh solvents or other chemicals to separate the oily molecules from other molecules. In other words, our essential oil that is produced does not have any residual harsh solvents inside. That is why steam distillation is definitely the preferred methods in order to make therapeutic grade essential oils. Remember, when we suggest a therapeutic intervention for our patient, we always need to make sure it is of the highest quality, so that if we recommend that the person takes in an essential oil, we're not actually exposing them to residual solvents or other chemicals. So good brands of essential oils will only use steam distillation to extract their oils. As you recall, at the end of the steam distillation process, in that final collecting bottle, we will have two products. One of it, which is the top layer, the essential oil layer, which is swimming above the water layer, contains over 300 odorous molecules from the plant and is basically the extracted essence, and is generally what we will be using in aromatherapy. Because it takes so much plant material that we then concentrate to make an essential oils can have toxic properties and are quite potent. So in our younger populations, we like to use the hydrosol, which is the water layer in that final collecting bottle, which contains only trace amounts of essence. It's made up of about 5% of essence. So the aromatic hydrosols is what we use on our babies, children younger than 3 to 4 years in general. It is less potent, less aromatic, but also less toxic. A few more definitions. Basically, two plants of the same species, because of their DNA makeup, will always produce the same types of aromatic molecules, but in different proportions. For this reason, we say that there are different chemotypes of the same aromatic plant. So for example, a thyme plant that grows in southern France, although it will produce the same aromatic molecules as a thyme plant of the same species growing in southern Italy, because the proportions will be different, the final therapeutic properties of these two chemotypes will be different. And we need to take that into account because that can influence both the therapeutic profile and the precautionary principles that we need to apply to use these essential oils. The way we write or talk about different chemotypes, I have given an example here at the bottom. So we would write Thymus vulgaris, which is the species of thyme used, and in bracket we will write linalool, which shows the actual constituent that is found in largest amount in the essential oil coming from this plant and indicates the chemotype of the plant. So this type of thymus here contains mostly linalool, and then we would need to understand the toxic and therapeutic properties of linalool to understand this chemotype better in its therapeutic usage. It's important to understand a little bit about the chemistry of essential oils. So here we're really only dedicating one slide to this, but it could be a much more involved topic. Here I will only very briefly touch on some of the toxic characteristics of certain essential oils that is important to keep in account when prescribing them to individual patients. So essential oils that contain phenols are generally toxic to the liver and to the skin. So in order to be used on the skin in particular, they must be very well diluted. Examples of that are carvacrol, of course, thymol, and eugenol, found in a lot of our Mediterranean plants. Because of their potential toxicity to the liver, there can be a real cumulative effect, so you don't want to be on these essential oils for too long a period of time. And if a patient has been self-prescribing, and in particular taking these oils orally for a long time, you may suggest that they do some blood work for liver function tests just to make sure everything is all right. Now we have certain essential oils that contain furocoumarins, like lemon, bergamot, or celery, and these are photosensitizing, meaning that whether you are applying them to the skin or taking them orally, it's generally not a good idea to go in the direct sunlight while being treated with these essential oils because the probability of a sunburn is much higher. Then we have our essential oils that contain ketones like camphor, carvone, thuone. These would be ketones that are generally neurotoxic. So those you do not want to use on people that have neurological complaints or things like epilepsy. We also have certain essential oils that will contain terpenes, which generally have nice therapeutic properties of tonifying, energizing, anti-allergic, anesthetic, but they can be irritant to the skin when used undiluted or in too high amounts. Examples of that would be pine essential oils or rosemary, pinene type chemotype, or juniper. Certain essential oils also contain different types of aldehydes, which can be nicely anti-inflammatory and calming to the nervous system, and they can help bring a fever down, but they can also be irritating in the long run to the skin. So that would be certain types of orange essential oils, Thymus vulgaris, certain types of cinnamons and mandarin. So most of those are safe when used properly diluted in small amounts in a small duration of time, but you do not want to use those undiluted or for longer periods of time, although that depends on your patient, so you always need to check in with them and see how they're doing while on those therapeutic recommendations with aromatherapy. So more practically now, how do we take essential oils? There are different ways of taking them, essentially 4 big ways. There is either orally, on the skin, by inhaling them, or by anal or vaginal use through a suppository or ovule. Essential oils generally do not have a good taste, and many of them are somewhat abrasive to the mucous membrane. So in order to take them orally, the traditional recommendation is 3 drops of pure essential oils, either placed on a sugar cube that is then chewed, or into 1 teaspoon of olive oil or any other edible oil. I would only recommend that the non-abrasive types of essential oils are used in this manner. Certain brands will also package essential oils for oral use in gel caps. Typically, the gel cap will contain a carrier oil like sweet almond oil, olive oil, palm oil sometimes for brands that are not so good. And in that carrier oil, in the gel cap, we will have a mixture of essential oils. Many essential oil companies are not that ethical or do not conduct very good research and are only interested in selling their products, and they will package relatively potent essential oil products in a gel cap. I only use gel caps packaged from reputable companies that will have had third-party testing. So a proper aromatherapy company will only use organic plant material to make its essential oils, and it will then only use steam distillation to produce the final essential oil. Some companies out there do not only use steam distillation and do not use organic plant material, and because these aromatic molecules are not water soluble, many of these residual chemicals will end up in your final product, i.e. pesticides or solvents. So you do not want to use these companies. Generally speaking, depending on the countries, there are labels from third-party organizations that are affixed to your product and that will tell you, of course, whether the plant material is organic, but the types of extraction methods that are used and so on. So you want to make sure you use a reputable company. You need to watch out because some companies out there will have a label affixed to their product, but it is actually a label from their own organization. So it's not from a third party testing organization, and so the label is virtually meaningless. Um, some of these companies promote taking essential oil gel caps basically continuously, which I do not advise due to the liver toxicity effects, the abrasiveness to the mucous membrane, the potential intake of residual chemicals if the company is not reputable, and also the fact that many of our essential oils are broadly antibacterial and can lead to dysbiosis or a disruption of the intestinal flora when taken continuously. So you really need to research the companies that you promote in your practice for essential oil usage. Topically, how we can use an essential oil is by placing either a few, so 2 or 3 pure drops directly on the skin, like at a site of a burn or a sting. You do not want to place a pure drop of an essential oil on any mucosal membrane, whether oral or vaginal or in the eyes, of course. Or topically, you can also dilute 3 drops in a teaspoon of any light carrier oil, like olive oil, sweet almond oil. Some people even use coconut oil, even though it's a little bit heavier. And this can be rubbed just about anywhere on the skin. Of course, if you rub it anywhere on the head or neck, the eyes may water and sting a little bit just from the aromatic vapors of the essential oil, an effect which should dissipate relatively quickly. If upon the application of an essential oil topically there is any stinging, redness, or other irritation, you can rinse it off with soap and water, and the effect will usually dissipate. Essential oils can also be inhaled, so generally they will be placed in a bowl of boiling water, and that steam can be inhaled, and we'll talk more about that later. This is great for ENT health. Um, when we want to use the essential oils vaginally, we'll usually place them in an ovule, which is basically an oily or fatty base, like a cacao butter base, in which we will have diluted and mixed a few teaspoons of the essential oil of choice. This is then inserted vaginally, typically overnight. And again, we will speak of that later in more detail. A few contraindications regarding the intake of essential oils. So, in pregnancy or in children below 6, we do not want to use any essential oils containing either lactones or ketones because remember, they can be neurotoxic. In the past, peppermint was used quite a lot in just about any population, but through more advanced research, we have found that it can create a sort of laryngeal spasm in children and compromise their breathing. So we no longer recommend using peppermint in children below 3 years old. In general, in those children, we will typically prefer using the herbal tea of the aromatic plant or the hydrosols. As we mentioned earlier, with essential oil usage, you always have to watch out for cumulative effects. We don't want to use these oils for long periods of time or continuously, especially not orally, or allergies. So many people will react with essential oils through skin allergies in particular, but their oral use could also trigger something like hives or eczema. So if you are going to start using an essential oil on an individual that seems to be sensitive of an allergic disposition, you always want to first test how they do with small amounts of topical or oral essential oils over one day, and then gradually titrate the dosage upwards. Of course, we only want to use essential oils that are 100% natural, meaning that the plant material that was used is organic, that no solvents were used. We want to see a brand that has a third-party testing and a label affixed to it. These are very important. It's also important to read the label because some essential oils are very expensive. So for example, sandalwood essential oil is quite expensive, and some brands will sell an essential oil that is labeled as sandalwood, but when you look at it, it is actually 80% jojoba oil and 20% sandalwood oil. The advantage of that is that it's already diluted, But however, it is generally better to have the pure product, and you can do your own dilution with it to tailor it to your individual client. So reading labels and not just the front part is also important, just like with any product. And remember that many essential oils are photosensitizing, so when you're using them orally or topically for more than a couple of days, you want to avoid sun exposure as much as possible. So this was in general the theoretical part of our presentation, which overlaps somewhat with your module. And now we will move on to the more practical considerations, which is the main uses of aromatherapy in the naturopathic practice. As you can see from this slide, essential oils can be used to treat just about any body system. The more commonly used ones are, of course, the use of essential oil in dermatology, in gynecological concerns, for digestive issues, for ear, nose, and throat health, which I'll refer to as ENT, of course. And then we will just very briefly touch on a few other common uses of essential oils. So there is a main running little essential oil kit that you want to have in your practice to dispense to your patients, or that you will more commonly recommend than others. And so these are the ones that I have been using most commonly in my practice, and that I'd like to share with you. So in dermatology, one of the better usages of essential oils, or that I have at least found very effective, is in dry eczema in particular. So here on the left-hand side, I have placed two pictures, one of dry eczema and one of wet eczema. Eczema usually starts like an itch on a patch of rough skin that looks relatively benign. The itch is very strong, and as people itch, it will gradually break the skin in microabrasions. As they heal, these breaks will turn the eczema into wet eczema, as serum exudes from those microcuts. Because of the healing, crusts will form, but unfortunately, because it's still quite itchy, if the person keeps on scratching these wet and crusted areas, the wet eczema will have difficulty healing. And of course, with wet eczema, we are worried about the risk of infection. So in dry eczema, and of course here we're talking about palliative use through essential oils, but when you're treating eczema, just like most of the conditions that I'll be talking about today, there is actually a root cause to investigate and treat. So with eczema, you also want to address, of course, their stress, their diet, and perhaps use other supplements for skin support. But for palliation and reduction of symptoms for your patients, you can use an essential oil of Santalum album, which is a kind of sandalwood. Watch out, because there are other types of Santalum essential oils which are not the album type. The one that is specifically useful for eczema is Santalum album. And the way to use it is to dilute about 3 drops of this essential oil in their classical eczema moisturizer. So it could even be a conventional one like Ceradan cream, Phytoderm, Aveeno, or you can recommend that they try a calendula-based cream or an aloe vera cream. Generally speaking, you cannot really recommend to dilute the essential oil in an oil, a carrier oil, because the olive oil or sweet almond oil or coconut oil are generally very occlusive and will prevent the skin from breathing. So what will happen is that the dry eczema is now trapped under a layer of oil, and it starts perspiring. And that perspiration beneath the oily layer will aggravate the itch for the person. So you need to put it in something that is really more of a moisturizer rather than an oil. But the sandalwood essential oil, a few drops in their moisturizer applied morning and evening on dry eczema, can bring nice relief over a week or so. There is now an Australian company that has planted a whole forest of sandalwood of the album type, in order to produce these essential oils for eczema treatments, and they're trying to patent some of these molecules. Once the eczema has turned wet, I generally then would either recommend a very dilute form of tea tree oil or Melaleuca alternifolia. So maybe 1 or 2 drops in a tablespoon, in a teaspoon of their moisturizer. Or what I really like using is a topical honey preparation. So in studies and traditionally, we know that honey has very nice broad antiseptic and wound healing properties. Up until this point, health professionals, we found it difficult to prescribe just adding any kitchen honey to your wet eczema because that is not a sterile preparation. And I was afraid that the sugar content of the honey mixed with whatever other bacteria in the air it just didn't seem right to put that on an already wounded skin area. But now we have a brand called Medi Honey, which basically has emulsified Manuka honey, so the New Zealand Manuka honey, in a gel preparation. And so that is sterile and meant for medical use. And the gel preparation means that the honey stays very nicely on the wound and underneath a dressing. So if it's wet eczema, I will usually recommend that for infection prevention. And I will tell my patients to monitor it. So if the crusts become very yellowish, painful, that is a sign of infection, and they may need to move to a prescription antibiotic cream or sometimes to oral antibiotics. The usage of essential oils on skin health is also commonly utilized in the practice for acne and abscesses or furuncles, or commonly known as boils. So basically a boil or abscess, I've put a picture of one here. It's like a big pustule. So it's like an acne pimple gone bad. It can be anywhere on the body. It is typically on the buttocks or legs. That seems to be the most predominant area where they appear. And basically what happens is that we have some sort of sebum production at the base of the hair follicle, and this sebum seems to attract particular Staphylococcus aureus bacteria, and the Staphylococcus creates an infection to which we have an immune reaction and therefore pus production, and that keeps on accumulating, and the skin over top becomes very taut and painful and hot. Abscesses can become huge with pus pockets about the size of a ping pong ball underneath the skin, sometimes a tennis ball. You do not want it to become that bad. Some people do not really feel them, especially on the buttocks, where they don't really look or where there's a lot of fatty tissue. So the abscess or infection has a lot of room to grow before we start seeing much on the surface. When abscesses become large enough, they need to be lanced at the GP clinic, which is a painful process that is rather avoided. So when they're still small is when you want to use aromatherapy. So you can put directly a few drops of pure Melaleuca or tea tree oil directly on the pimple. So that would be an acne pimple or a small pustule. If it has become larger or more cystic type of acne, what you will recommend that the person does is brew a cup of hot, strong green or black tea, organic if possible, of course. You want it to sit steep covered for about 10 minutes, so it's a real strong tea. And then after that, the person will dip a compress or cotton ball in the hot tea, let it cool just briefly so it's tolerable, and apply it as hot as possible to their abscess. As the compress or cotton cools down and becomes lukewarm, they need to remove it, take another cotton, dip it again in the hot tea, and again put it on the abscess. This is best done after a hot shower. The heat brings circulation to the area and helps the boil come to a head. Black or green tea has astringent properties, so it strengthens or tightens the skin over top the pustule, so that it comes to a head faster and there's evacuation of pus and therefore great relief in terms of pain and getting rid of the infection. After the person has done that and hopefully there has been some pus expulsion, that is when you would apply a few drops topically of tea tree oil overnight, which also has some drying qualities. You could also apply again the Manuka honey preparation to try and fight the infection. For wasp stings in particular, or rather severe second-degree burns, you can use Lavandula latifolia topically, a few pure drops directly on the sting or burn every 5 to 15 minutes for the first hour. Again, remember your first aid. If the second-degree burn is indeed there, you will know it because there will be blisters and a great deal of pain. The first aid to do at that point is to turn the tap on cold and to let cold water run over the burn for about 15 minutes. That is because you want that coolness from the water to penetrate the deeper layer of the skin that has been affected. You don't put ice and you really let the water run over top for 15 minutes. After you have done that, that would be the time to apply your pure drops of Lavandula latifolia on the way to the hospital if it is over a large surface, on a child, or if it looks very bad. Second degree burn, you might want to get it looked at. If we're talking about a lighter first degree burn, then we use true or real lavender, which is Lavandula officinalis. And again, we would use a few pure drops on the area every 15 minutes or so for the first hour. If it's a larger area, you could dilute a few drops in a teaspoon of a carrier oil and apply it, massaging it that way. The first hour I would do that, followed by aloe vera gel afterwards to bring further cooling relief. So these are the main areas where we'd use essential oils in skin health. For gynecological health, one of the places where we use a lot of aromatherapy is for yeast or bacterial vaginal infections. The symptoms of that are similar in that both of them will create some amount of itch and irritation and discharge. The discharge in a yeast infection is classically called cottage cheese discharge. So it's a thick, white, clumpy discharge that is quite obvious, whereas a bacterial infection usually yields a yellowish or greenish kind of discharge and is often less itchy than a yeast infection. Again, if it really degenerates, the person may need to consult a gynecologist and get a conventional antifungal. But a very nice home treatment for it that usually takes care of a number of these types of infections is to use the properties, the aromatic properties of the garlic plant by using a simple kitchen garlic clove, which is peeled, and then small incisions are made on the clove with a knife in order to liberate a little bit more of those essential oils from the garlic. And a piece of floss can be tied around the garlic clove so that it makes a bit like a homemade tampon. On the picture on the left, they have threaded a needle attached to a piece of floss in order to then have the floss go through the hole made by the needle to attach the floss. That is typically not necessary. It sometimes takes less time and is easier to just make a few small incisions on the clove and tie the floss around it. So how it's used, it's basically the garlic tampon is inserted as far up as possible close to the cervix overnight, possibly with a panty liner, for a few nights in a row. Garlic has very nice antiseptic properties, but it can be a little bit abrasive to the mucous membrane, so women can tolerate between 1 and 7 nights with the garlic clove inserted. If the yeast or vaginal infection is already very settled and the person has scratched a lot and the tissue is therefore very irritated, the garlic clove can create some sting and further irritation. So in that case, you would not use the garlic clove as much, although it's probably what they need to fight off the infection. Some preparations are made commercially and are basically ovules. So it's a cacao or shea butter base with a few drops of tea tree oil in there. And so again, the ovule is inserted vaginally as close as possible to the cervix. If it's a cacao butter base, it will melt almost immediately when it comes in contact with the mucous membrane. And so you need to have the person wear panty liners overnight because some of this cacao butter will leak out and stain. So you can use either the garlic clove or the tea tree oil ovule anywhere from 1 to 7 days, and you would follow that with about 7 days of vaginal probiotic capsules to try and reinstate proper vaginal flora on the mucous membrane, which will compete for both food and space with either the candida or yeast organisms and whatever bacteria may have been there. Remember your other principles though. If it feels like it's getting worse, you would refer to a gynecologist. Another frequent place where we'll use aromatherapy in gynecology is for the case of very heavy periods. Again, if the woman is complaining of significantly heavy periods or periods that are becoming heavier over time, we first want to assess what is the cause of this heavy bleeding. Is there the presence of a fibroid, a polyp, endometriosis? So it's always good to first have your patient go to the gynecologist, get an ultrasound and a checkup. And if there's no action to be taken there, i.e., no real acute organic lesions that need to be taken care of, perhaps conventionally first. So if the heavy menses are really just functional, or if you know that there is a polyp or endometriosis and the person is just waiting to have their medical treatment done, these are the scenarios where you can use aromatherapy to provide relief to your patient. So what we often use is cinnamonium or cinnamon essential oil, a few drops, 3 to 4 drops in 1 teaspoon of carrier oil that we would then massage on the lower abdomen. This gets absorbed to the uterus, and cinnamon has strong astringent hemostatic properties. So in other words, it constricts small blood vessels and reduces bleeding. Cinnamonium essential oil can be a little irritating to people who have very sensitive skin. So we do not recommend it, like in redheads, for instance, people who have eczema or other lesions on their abdomen, and we would not use this oil in children. So if a very young child, like a 11 or 12-year-old girl, is already menstruating and has heavy menses, I would not suggest the essential oil of cinnamon. We can also encapsulate cinnamon bark, which is of course where the essence comes from. So this would be in a way a less toxic or abrasive intervention. And you can use the capsules of powdered cinnamon bark orally. And this would be a usage that you could use in a younger person, but of course you would adapt the dosage to their weight and sensitivity. And this generally also really helps with heavy periods due to the aromatic properties of the cinnamon. Another common place where we use essential oil would be for certain types of digestive complaints. When the person complains of bloating that is occasional in nature, like for example, after they've eaten a large meal, or if they know they have certain food intolerances but ate some of these foods anyway, sometimes around a period it can create more of digestive flatulence as well. Or if a person is recovering from some sort of stomach flu, you can then recommend peppermint or mentha piperita topically. So again, 2 or 3 drops diluted in a teaspoon of carrier oil, rubbed all over the abdomen. This will feel very cooling to the skin. It's generally quite pleasant. And as it penetrates into the intestinal area, it has carminative properties and also analgesic properties. So it will break down the large gas bubbles into smaller bubbles, just like charcoal might, and bring relief to the patient. You can also use orally, and again, for their aromatic properties, fennel seeds or celery seeds or mint leaves or cumin seeds or coriander seeds, all of those contain essence that is carminative and helpful to the digestive system, which is why in the Indian culture it is common to chew those seeds after a meal, and they will relieve some amount of bloating quite effectively. Now, if the person is presenting with chronic bloating and lots of eructations or burping frequently or chronically, you will suspect that they are due to either a food intolerance or colonic dysbiosis, so in the large intestine, or SIBO, which is small intestinal bacterial overgrowth or dysbiosis in the small intestine. In that case, you need to clean up their diet, figure out food intolerances, but an oral treatment of essential oils is very effective to try and remove some of this dysbiotic imbalance. Like I said earlier, especially for oral use, you need to go with very reputable natural product companies. Again, there are many unethical or not so reputable essential oil companies out there who will encapsulate essential oils and recommend their continuous use without having done proper research and without proper third-party testing that their oils are both organic and solvent-free. So I like to use Metagenics just because they have a nice formulation for dysbiosis and SIBO. This is one of the commonly used products, and you can see what's inside. So we have thyme essential oils, and they tell us, it's mostly thymol, oregano, mostly carvacrol, and sage, and a little bit of lemon balm for its calming properties on the digestive system. So remember these oils, carvacrol and thymol, they have some additive toxic effect, especially when used orally, as you recall from our earlier discussion. So for those oils, remember they can be liver toxic when they're used orally for a long time. So you want to make sure that your company has made gel caps with an appropriate dilution of essential oils so it's not so abrasive to the mucous membranes, and you do not want to use this continuously. So this bottle of 60 soft gels will typically last for anywhere from 3 weeks to a month, and that is the longest that I would use day in and day out of this product. Generally, I would follow with probiotics and mucous membrane protecting agent like slippery elm, aloe vera, zinc, and after maybe a month or 6 weeks of that, if their symptoms have not really subsided, that is when you might consider doing another round. So that is one of the only places where I use oral essential oils, and I do it with great caution. The ENT sphere is, of course, a very useful, a sphere where essential oils can be very, very useful. So we will often use the essential oils of Eucalyptus radiata. It is favored over the more common globulus type of eucalyptus. And in the case of a sinusitis or a ear infection, we like to recommend it as a steam inhalation. So what we do is boil about 1.5 liters to 2 liters of water in a kettle. When it's really, really hot, you pour it in a large bowl. Then you would put 3 to 5 drops of eucalyptus essential oil. You then get the person to sit next to the bowl, inhale the steam, and cover their head and bowl with a large towel, and stay under there for as long as possible, which is usually anywhere from 5 to 15 minutes, and taking breaks. This has a dual action. The eucalyptus essence is, of course, very broadly antiseptic, which is great to get rid of some of the bacterial load that is sitting in the ear canal and in the sinuses. But also the hot steam from the water will dilate a whole bunch of small blood vessels and capillaries around the face and head area, and it will promote circulation around the sinuses and ears, which will of course promote healing. So you want to do a steam inhalation about twice a day at the peak of the acute infection. A couple of notes of warning. A lot of young children are prone to sinusitis and ear infections, and for them, the large bowl of boiling hot water may be a concern, so we usually do not recommend it for children below 6 years old who are unable to really listen to instruction or are very restless. For those children, we will prefer a diffuser, which is a small contraption you can plug into your power outlet, put water in it, and it will continuously diffuse steam. So there's less hot water that you can pour all over yourself. So you can either diffuse it in the child's room at night and close the door, or you can have the child breathe in the steam, but you need to be right next to them and monitoring. Eucalyptus can also be rubbed on the chest, so diluted in a carrier oil like olive oil at night. It needs to be rubbed in a thin layer at the front, the sides, and the back of the chest. And you need to make sure the child is wearing a t-shirt over top, because you do not want them to place their hands in the eucalyptus and then scratch their eyes, because that would be very irritating. You can also apply some diluted eucalyptus to the soles of the feet, where the skin is very thin, and allow better passage or absorption into the body. And we like to use the same type of eucalyptus on the soles of the feet or as a chest rub during contagious illness. So in families, it will often happen when there are multiple children that one child catches some infection and then all other children are sick. So when the first one is sick, you can rub everybody on with eucalyptus essential oil as a chest rub or the soles of the feet to try and prevent that, or diffuse it in the bedroom at night. For middle ear infection or otitis, we like to use Lavandula stoaceus, which is different from our Lavandula officinale and more effective in otitis. So this is a topical use where we put 2 or 3 drops of the essential oil of this Lavandula stoaceus on a cotton ball, which we'll then insert in the ear canal and let it sit overnight. And you can repeat that during the day as well. And it brings almost instant relief of the atrocious pain that comes from a middle ear infection. So this can be quite a godsend when the ear infection occurs in the middle of the night, which it typically will. And you need some immediate relief before you take them to the GP the next day for them to look in their ear. For very young children below 4 years old, what can also be hugely effective in wet cough, sinusitis, ear infections is to do a herbal thyme bath. So remember that in children this young, who are indeed very prone to ENT infections, we don't really want to use a steam inhalation due to the risks described earlier. So we can still use our chest rub and our foot rub, but what we can also do is basically use the herbal tea of thyme. So what we do is brew a couple of liters of strong thyme herbal tea. So you need to brew it covered, right, for 10 minutes to half an hour. And then you would find a little plastic bathtub like is commonly made for babies and infants to bathe. You would fill the bathtub with normal water, not too much, maybe only about a quarter or a third of the bathtub, as hot as the child can take it. And then you would mix your 1.5 to 2 liters of herbal thyme bath in the bath water. And make sure you have strained out the thyme leaves, of course, because the child will not really like the leaves in the bathtub otherwise. And then what you want to do is close the bathroom door and have the child play or stay in the bathtub for at least 15 minutes. So this has a dual effect. A, because children have very thin skin and they're soaking in this thyme herbal bath, a lot of the active properties of the thyme essence are penetrating through their skin, and also, and especially if the bath water is relatively hot and the bathroom door is closed, they are inhaling the steam from the thyme. And this is doing like its own little steam inhalation, but just less potent, less irritating for young children. And you can repeat that once or twice a day for a couple of days to help loosen up the mucus and kill some of the bacteria in the ENT and respiratory system. So a very nice little home treatment to know about. With older children, you can do it too, but the problem is that they no longer fit in a tiny bathtub. And so you would need to make several liters of the thyme herbal tea for it to be effective. And because these children can typically listen, they can handle a steam inhalation. which would be easier to do on them. When there are ear infections or sinus infections, another useful tool to know about is to use the essential oil of grapefruit or Citrus paradisi for lymphatic massages around the ear area. So what happens in an ear or sinus infection is that the bacteria will lead the lymphatic glands to swell up, and you can see them in green on this diagram in that area. They swell up and become congested due to the work required to fight the infection. So to ease some of this congestion, after the child has showered, you want to dilute 3 drops of grapefruit essential oil in a teaspoon of carrier oil, and you want to massage that whole ear area from the top down in rather firm massages, downward strokes. So going from the ear, the front of the ear, downwards along this muscle here that connects the ear to the collarbone, which is the sternocleidomastoid muscle. So you want to massage downwards from the ear to the collarbone, and then downwards from the back of the ear to the collarbone, and then downwards from the nape of the neck to the shoulder on the trapezius muscle. And we're doing this downward to reduce the head congestion and help the lymph drain properly. So you can repeat that 2 to 3 times a day. Children generally find this quite pleasant. It should not be painful. And the grapefruit essential oils has some nice lymphatic stimulating properties. You could also dilute the grapefruit essential oil in a teaspoon of castor oil, which itself has very nice lymphatic tonifying properties. Some children don't like it because castor oil has a very sticky texture, and they can start perspiring underneath and scratch and just find it unpleasant. And because the parent would need to repeat this a few times a day, a few days in a row, you need to make it as comfortable as possible so the child will cooperate. So why we're doing all of this, the steam inhalation, the thyme bath, the massage, is because we want to try and avoid to have to use antibiotics on the ear or the sinus infection, and try to hopefully get rid of it with aromatherapy. Of course, if the state of the child seems to worsen, if the pain is unbearable, if they start needing acetaminophen to relieve the pain, you would need to send them to their pediatrician or GP to get a further assessment. And you might want to use some oral herbs like echinacea as well to help fight the infection. Another few very common uses of essential oils is, of course, using peppermint topically on the skin for headaches. Typically does not work as well for migraines, of course, but for a normal kind of tension headache, you can then put a couple of drops of pure peppermint essential oil on the temples and the nape of the neck. If that is a bit irritating to the eyes, you can of course dilute that in a little carrier oil. Peppermint essential oil is very analgesic and usually will bring instant palliative relief. For toothaches, it's also very useful. So again, it doesn't go to the root of the problem, but just brings pain relief. You can apply a few drops directly on the affected gum and tooth and massage it. That will bring very nice relief. Again, do not do that in children below 4. Remember the warning on peppermint. For insomnia or nervousness at bedtime, you can use Lavandula angustifolia topically again. So either as a foot rub by diluting a few drops in a carrier oil, or you can put a few drops on the pillow or massage it on the chest. Or you can even buy these small lavender pillows that are made from dried lavender flower and that emit a very nice smell. That will even help children unwind a little bit at bedtime. It's a very gentle intervention. So this is our summary slide. As we discussed, aromatherapeutic therapies are very useful in the naturopathic practice, but you need to know all about their side effects and counterindications because remember it takes several kilograms of aromatic plants to make essential oils. So they're very potent tools. In very young patients below 4, we like to recommend hydrosols, which only contain 5% of essence, or herbal teas that can be used topically, like the herbal bath we talked about with the thyme. Essential oils in general we don't recommend in pregnancy and lactation. There we would prefer hydrosols, herbal teas, and so on. And remember not to use essential oils continuously, especially if they've been used orally. They can have cumulative toxic effects, in particular on the liver. They can be photosensitizing, they can be neurotoxic and induce epilepsy. So you are using them acutely or in a very specific time frame that you want to educate your patients about. So that was our discussion on aromatherapy in the naturopathic practice, and I hope you have found this interesting. We've now come to the end of our presentation, so wishing you all a great rest of the day.